I think what we have to start the conversation with first is really trying to understand what trauma-informed means, and that frequently in the organizations that I work with throughout the country, people will call me and say, we've had a committee to be trauma-informed for years, and we really understand why this is so important, and we really aren't getting anywhere. We know there's some next steps that we have to take, but we've never really been able to get organized and never really been able to do that next thing. And what we did at the National Council is we developed a tool called the Organizational Self-Assessment. And with that tool, we took the thoughts and the ideas from the leaders in the field, such as Roger Fallett and Maxine Harris and Judith Herman and Sandy Bloom, and tried to synthesize their work in a way that expressed the practices and principles of what it means to be trauma-informed. So, for example, safety first, or transparency and mutuality and choice and voice and control and collaboration, and giving people control back in their lives. And so, what we did is we created an instrument called the Organizational Self-Assessment, using those pieces of the practices and principles to operationalize what it looks like in an organization to move towards being trauma-informed. And it's the OSA is a Likert scale of 0 to 4 with a not applicable included. We took and created the 7 domains of trauma-informed care, and in those 7 domains is where you capture those principles. Under each domain, there are multiple standards, and those standards are not the only standards, but the idea of the OSA is to get organizations to think a little bit differently about the work that they do. So, for example, in the 7 domains, the first domain is screening and assessment. So we want to have an experience for people upon entry into an agency where screening is done, but we also want to have people have the opportunity to talk about any of their experiences in a sensitive way and over time. If I'm someone coming into an organization and I may be very, very scared, or I may not trust you if you're the intake coordinator. But what we want to be able to do is to create an environment where people do feel comfortable answering some of those questions. And people need to be trained in how to ask the questions. They need to be trained in how to establish the relationship from the very, very first time anybody walks through the door. The second domain is consumer-driven care and services. And I'm so thrilled with Community Healthcore and the way they're thinking about the work they're doing, and the numbers of peers that are being trained and are being utilized in really wonderful, wonderful ways. And that's not the only piece. Peers are able to see services through a very, very different lens. We know what it's like to go through a screening and assessment process. We know what it's like to be funneled into a group that really is not working for us. We know what it's like to be re-traumatized by the system. And being able to have that voice as part of all of the work, that's one piece of consumer-driven care and services, but it's looking at things from that real recovery-oriented perspective where it's consumer-driven, it's person-centered, and that if I'm the person receiving services, I have an opportunity to say what works for me and what doesn't. I'm really bringing that voice and making sure that peers, consumers, clients, however you frame the language, that people have an opportunity to really talk about what's working well in the organization and what doesn't work well. We also talk about workforce development in an educated, trauma-informed workforce, and that is including clinical training. Clinicians need to have adequate training to do their jobs. But if I'm the receptionist, what does it mean for me to be a person working in a trauma-informed organization? Every person makes a difference. If I'm the van driver, if I'm the maintenance person, I make a difference in creating that community where people feel that they can begin to heal. And also thinking about compassion fatigue for staff. In our earlier work today, we were talking about internal customer service. It's how every person in the organization treats each other. You cannot have a trauma-informed organization if staff is so overworked that they experience compassion fatigue. So, thinking about the needs of staff, but also thinking about how that impacts, if I'm not taking care of myself, how can I really be there for another person? It's also about good clinical supervision. Are you supervising in a way that's trauma-informed rather than supervising in a punitive way? Domain 4 is evidence-based and emerging best practices. It's always looking at, it's not saying this is the one thing that we're doing and it's evidence-based and never looking at the new and emerging things that are happening. It's always having an eye towards the good stuff and really, providing the training for staff, using peer-delivered evidence-based best practices like WHAM, Wellness Health Action Management, where peers are really helping other peers take control of their own physical health, or WRAP, Wellness Recovery Action Planning, is a great trauma-informed tool to use that's evidence-based. And then creating safe and secure environments. People cannot heal if they do not feel safe. If you're on hyper alert, if you feel like that you're walking into an environment that does not welcome you, where you do not feel safe, nothing good's going to happen. I had somebody tell me, I was in a meeting, and they just repainted and updated their reception area. And one of the clients came in and said, "Are we moving?" And the person said, "No, why?" "Well, we figured if you were making it this nice that we were going to have to leave." And that's a real indicator that people did not feel highly valued. It was a huge lesson for them. People deserve to be treated in a place and in a way that that says, "I respect you. You're valuable." You can't begin to heal until you begin to feel those things. And then Domain 6 is about building community partnerships. Whoever we are in our community, we have to work to make communities trauma-informed. Healing doesn't happen in a vacuum, so if I receive great services at your program, but I go out to, Department of whatever, and they treat me like I'm, mud on the bottom of your shoe, it undoes all the good work I did when I was working with you. So really, really reaching out into the community and help the community understand what it means to be trauma-informed. And finally, Domain 7 is all about performance improvement. Performance improvement. How do you know what you're doing is making a difference? If I do X, is this going to work for me? Is this working for the people that we serve? Am I doing client feedback surveys? Am I asking clients about the level of safety that they feel? Am I surveying my staff? And then once I do the survey, do I do anything about what it was I just surveyed? So, the way we use the OSA is we ask organizations when they start the assessment, that's their baseline. And then we ask them over a period of time to do it again so they can see the progress that they've made. And then we use a number of other tools, a performance monitoring tool and an implementation guide to help organizations move forward. But that's kind of the OSA in a snapshot, very quick snapshot, because it's a long process. It is not, the OSA is not designed for organizations to just say, okay, we're done now. It is not a checklist. It's a way to guide conversations to begin to make significant change within the organization.